Leaving a Baby in the Hospital, Prematurity of the Newborn by Maddie, Abby, Sarah, and Annabelle. We hope you enjoy! Leaving a baby in the hospital following a premature birth is an important and complex issue within midwifery care. Prematurity of the newborn, parents having to leave the hospital without their baby, mental and emotional health impacts, challenges with bonding and attachment, breastfeeding, social implications, and preparing parents to eventually take their premature baby home are all key aspects of this topic. Although there are many areas that could be explored, our group has chosen to focus on the mental health impacts, as this area strongly influences many aspects of this transition to parenting with a preterm baby. A premature baby is defined as a baby born before 37 weeks of gestation. In Australia, about 8 in every 100 babies are born early, many of whom require specialised care in a neonatal intensive care unit, otherwise known as the NICU, which often involves 24-hour specialised medical support to assist immature organ systems, regulate temperature, provide nutrition, support breathing, and many more. Babies are often admitted to the NICU within the first 24 hours after birth, with their stay ranging from a few days to several months. During this time, some mothers are discharged from the hospital while their baby remains admitted, resulting in parents having to leave their hospital without their newborn, creating a highly stressful and emotionally challenging situation for these women, especially during the early stages of bonding and attachment. For many women, preterm labour occurs unexpectedly, leaving little time to adjust to changes in birth expectations. Parents often imagine immediate bonding, skin-to-skin contact, and taking their baby home shortly after birth. However, when NICU care is required, these expectations can quickly change, and parents may face uncertainty, separation, and loss of control. This dramatic shift can be super overwhelming, as women are required to adapt to not only an unplanned birth experience, but also to a highly intensive medical environment for their newborn. Whilst the NICU is required and essential for survival, it can feel super intimidating and unfamiliar for these new parents, as well as limiting physical contact, causing mothers to feel disconnected from their role, which can further challenge their confidence and sense of identity during early motherhood, negatively affecting their mental health. This large difference between their expectations and reality can increase the emotional stress for women and will contribute to feelings of anxiety, helplessness, and in some cases, postnatal depression or anxiety. For this reason, support from the healthcare professionals, including midwives, as well as family support, is essential during this time to help women in their challenging transition to new parenthood.
Leaving a premature baby in the NICU significantly affects a mother's emotional well-being. The physical separation between the mother and her newborn with restricted interactions creates a distressing environment. Many mothers experience prognostic uncertainty, where constant concern about their baby's health and well-being increases anxiety and emotional strain. Feelings of guilt are also common, particularly when the preterm birth occurs abrupt without sufficient emotional preparation. The NICU itself is an environment that intensifies mothers' emotions and concerns. It is a highly medicalized environment with a large amount of overwhelming visual and auditory stimuli. The NICU is an environment where mothers temporarily lose control over their baby's care, contributing to emotional exhaustion. Overall, the combination of separation, prognostic uncertainty, and sensory overload makes the NICU itself a major factor that affects mothers' emotional well-being following a preterm birth. Mothers of premature infants have a higher prevalence of postpartum depression, generalized anxiety, and post-traumatic stress symptoms. Studies have shown that up to 40% of mothers with preterm infants experience postpartum depression, compared with approximately 15% of mothers following full-term birth sharing these same symptoms. These symptoms can begin within the first week of postpartum and consist for up to 1 year, affecting mother's ability to care for not only herself, but also her child. Longitudinal studies have revealed that stress levels often decrease after NICU discharge, although many mothers continue to exhibit these symptoms of anxiety for up to 12 months after. Anxiety disorders occur in mothers of premature infants due to the chronic stress associated with their child's health during the NICU stay. PTSD symptoms may develop following a preterm birth, triggered by their individual experience in the NICU, influencing future feelings about pregnancy and childbirth. These mental health challenges can affect maternal confidence and complicate the transition to early parenthood, highlighting the need for ongoing psychological support. The table on the left illustrates the estimated levels of maternal distress in preterm and full-term mothers dependent on the child's age. As shown, the level of estimated distress is higher for women with preterm infants, suggesting that experiences from the NICU are not just overwhelming in the moment, but contribute to form longer mental health outcomes. This research indicates the ongoing psychological challenge preterm mothers face.
After birth, the mother may face significant challenges regarding bonding and attachment. When the baby needs to go straight to the NICU post-birth, the midwives will offer to take the mother to be with the baby. However, In some cases, this may circumstantially prove not possible. For example, if the mother needs to be separated for her own medical attention. As a result, some experiences the mother may miss are golden hour, which involves uninterrupted skin-to-skin, assisting in initial bonding and attachment post-birth, experiencing the desired labor and birth, building a breastfeeding routine in the initial days to weeks of life, expected homecoming rituals, and traditional firsts regarding the early transition. When the mothers are not able to experience this with their newborn, challenges may occur in their postpartum journey. The recovery process for a mother with a baby in the NICU can be slower and more difficult as they are regularly traveling back and forth to the hospital. This often results in a very different outcome to what the family was expecting. Some challenges that the mother may face due to this include separation trauma caused by being away from each other at a crucial part of a newborn's life, difficulties bonding at the start as mother and baby are not able to connect as much physically at the start of the baby's life, and discharge anxiety around taking a fragile baby home without the same support they had at the hospital. The effects of trauma on the milk supply. This emotional and physical trauma for the mother can also affect her milk supply, which then can affect her ability to express milk. As a result of premature birth trauma, the mother may not produce high levels of oxytocin as she would from a normal physiological birth. This can impact the mother's milk supply responding adequately to the baby. It is common for premature babies to not be able to latch or breastfeed as they are underdeveloped. This makes it even more important to encourage the mother to try pumping to express milk if she feels comfortable to do so. This will allow the baby the opportunity to have their mother's milk supply, even if breastfeeding is not possible. Expressing will also enable both parents the opportunity to feed the baby and develop a bond with their child. Breast milk will also supply the baby with important nutrients for early life development. If the mother chooses to try pumping to increase milk supply, this will normally involve a specific process to ensure the best possible outcome. The process of expressing when the mother has a NICU baby involves trying to pump 5 to 6 times a day for the first 5 days. This technique has been proven to help increase milk supply and hopefully establish close to a full milk supply in the ongoing weeks after birth. This will not always be effective for everyone though, but if the mother is open to pumping, it is encouraged.
What can the midwife do? It is important for a midwife to curate their skills during this time to enhance the maternal confidence of a mother faced with fear and shock. Considering preterm birth is the direct cause of 35% of all neonatal deaths worldwide, it is fair to say most mums don't feel in the clear post-preterm labour and birth. In order to allow for some of that fear to fall away, it is primarily important to involve the mother in all practices she feels comfortable with to develop the connection with her baby. Midwives and lactation consultants should always be available to mums going through a premature birth. However, correct care is not always offered or performed appropriately. Care should be offered aligning with unique circumstances that follow preterm birth. This involves lactation. If breastfeeding is not an option, the midwife can assist with bottle feeds and support and supervise skin-to-skin during this process. Another important aspect a midwife should consider is integrating and involving the mother into all post-birth general care, such as nappy changes, conversations with her baby, and having mum present during all NICU processes. These will not only help with bond and connection, but can promote fast healing for both mum and baby. This is why kangaroo care is so important and effective if possible. This care model involves as much skin-to-skin contact of baby and parent when feasible, having the baby lying on the parent's bare chest with nothing more than a nappy if necessary. Having this time to be present and experiencing raw attachment can release the weight of some of those discussed birthing traumas. When guiding families through this transformative time, midwives should consider promoting the simple tool of touch and smell. Just a handhold in the NICU or a blanket that smells like mum or bub can majorly increase bonding and promote calm during an intimidating time within a medical environment. Midwifery care regarding mental health. From a more general angle, a midwife can reshape their typical support styles to hold a mother and her family through this less common and unique birthing experience. proven to so heavily impact one's mental health. Considering the medicalized setting and routinely clinical processes, it is important to bring a sense of normality back into play. Opening a safe, open and continuous conversation that allows mum to speak freely and emotionally is crucial and the first step no matter what, however tenfold as a midwife in charge of mothers having a premature baby. Being able to normalize and validate heightened emotions with grace and answer the entirety of her long list of questions judgment-free is a crucial aspect in fostering trust between this two-way relationship. She must feel confident, secure, and emotionally heard in her environment before she can advocate for herself, her baby, and her boundaries. For example, preferences of care and maternal needs. Once mum and her support people have found their new balance and new norm, it is important to remember the regulation of their emotions and state of their mental health will be leaving your care and moving into the independence of their home life. Unfortunately, likely without a baby. Postnatal wellbeing checks can save a mother from isolation. A major tool a midwife has is access and experience with support services and resources. Some resources available for this transition are listed below. Following everything we have advocated for throughout this presentation on preterm birth, it is as important as ever to present continuous and respectful culturally safe midwifery practice, ensuring holistic care for every woman. Although general specialised care is priority during this time, it is just as important to take an interest in each mother's cultural preferences throughout each process of preterm birth and post-birth care. In order to ensure this is achieved, it is important to minimise miscommunication through language barriers. An example of appropriate, culturally safe midwifery care is organising a translator to be present at all times or at a minimum during any decision-making processes, especially throughout the time the baby is moving through early life within the clinical NICU environment. Thank you for taking the time to listen to this presentation.